Hello, I'm Dr. Tessie, one of the doctors in the practice today. Could I confirm you're Mr. John Smith?
Yes, I am.
Okay, and how old are you?
51 years.
Okay, how would you like me to address you today?
Just call me John. That's fine.
Oh, John, you're welcome to the practice. All right,
Nice to
John,
see you, doctor.
could you please tell me the reason for this consultation today?
Yes, doctor, I've been having this croaky, raspy voice lately, and I thought I should come and check it out.
Okay, could you tell me a bit more about this voice change?
Yes, doctor. I've been noticing this cracky and raspy voice in the past 3 weeks, and I thought I should come and check it out.
Okay. Before this voice change started, is there anything that triggered this?
No, just nothing seemed to have triggered it.
Okay. The voice change, would you say it's getting worse?
I would say it's getting worse because it starts in the day, and before the day goes by, the voice is almost gone. And
Okay.
it's been coming and going like that now in the past 3 weeks.
Okay, on and off. Is there anything that makes it worse?
Not that I know of, doctor.
How about anything that makes it better?
Not that I know of, doctor. Like
Okay.
I told you, as I try to talk, it gets worse and it's gone by the end of the day.
Okay. Apart from this voice change, anything else, John? Anything else?
Like what, doctor?
Any pain while swallowing?
No, I've not got any pain, doctor.
Any difficulty with breathing?
No, nothing like that, doctor.
Okay. Are you still able to eat and drink as you used to?
Yes, doctor.
Okay. All right. Just a bit about your general health, John. Are you being managed for any medical condition?
No, doctor.
Okay. Are you on any medications?
No, doctor.
Do you have any allergies, John?
Not that I know of, doctor.
Okay. Is there any family history of similar conditions, if I may ask?
No, doctor. Similar condition like these voice issues? No, doctor.
Yes, John. Okay. Thank you for answering my questions so far. Just a bit about your lifestyle. How is your diet like?
I eat everything. I eat junks. I eat anything.
Okay. Do you by chance take alcohol?
Yes, I do take alcohol. I take about 2 to 3 bottles of beer every day.
Every single day. Okay. We'll talk about that in a little while. How about smoking? Do you smoke cigarette?
Yeah, I smoke 20 sticks a day, and
Okay.
I've been
For
doing
how
that for
long?
the past 35 years. Yeah, for doing that for the past 35 years.
Okay, we'll address that shortly as well. Just by chance, have you considered quitting smoking?
Why should I, doctor?
All right, we'll address that in a little while, John. Is that okay?
That's okay, doctor.
All right, John, do you by chance take any drugs for recreational purpose?
And no, doctor, I don't use drugs.
Okay. What do you do for job?
I'm a mechanic. I work at a garage.
Okay. All right, John. Since this voice change started 3 weeks ago, has it affected your life in general?
Uh, Doctor, I've been really worried about it, and I really want to check it out.
Oh dear, I'm really sorry you're passing through all of this. Must have been a really difficult time for you. All right, John. Do you have an idea as to the cause of this change in your voice?
I'm not actually sure why I'm having it, doctor. So but this hockey voice is really touching me.
Okay, we'll address that shortly. And apart from this voice change, is there anything you're most worried about?
I'm concerned that this could be something serious like cancer. Could it be something like that, doctor?
Okay, your concerns are valid, John. I'll address it in a short while. Is that okay?
Okay.
All right. John, what are your expectations from today's consultations, if I may ask?
I'm hoping that you're going to do an MRI of my throat and see what's going on there.
Okay, that's fine. All right, John, thank you for your time thus far for answering my questions. At this time, I would like to examine you I'll be checking your observations, how fast you're breathing, how fast your heart is beating. I'll be checking your blood pressure, and I'll also be examining your mouth, your throat, your ear, nose, and throat. I'll be examining your chest as well, listening to your heart and your lungs. Is that okay? I'll be
That's
doing
all
all of
right.
this in the presence of a chaperone while I ensure your privacy is maintained. Can I go ahead?
Sure, doctor.
Okay. All right, John, thank you for answering my questions and allowing me to examine you. From my assessment, John, I know you are most worried about having a cancer, but I would like to reassure you that this is not a classical case of cancer. Cancer would not present like this, in this manner, okay?
Oh, that's reassuring, doctor. Thank you.
2 minutes
Thank
remaining.
you, doctor.
However,
Thank you, doctor.
I'm not really sure of what you're having. I'll be consulting with my seniors to find out, to review you as to the cause of your change in voice. However, John, I do suspect, from the history I've gotten from you so far, I do suspect this could be as a result of your lifestyle habits. Are you with me, John?
Yes, doctor.
Like you
What
rightly
about my
said,
lifestyle, doctor?
like you rightly admitted that you take 2 bottles of beer every day, and your smoking habit as well. This could be contributing risk factors as to your voice change. Are you with me so far?
I understand, doctor. Okay.
Okay, John. So at this time, I'll be requesting for some more investigations, okay? And also there are some things you can do for yourself, like quitting or reducing the quantity of alcohol you take. The recommended is 14 units per week with 2 days free. Is this something you're willing to do?
Oh, okay. We'll look at that. I'll try, doctor. Doctor, will you be doing the MRI for me to look at my throat now?
No, it's not in my capacity to do an MRI for you, John. I know you're a bit concerned about having that MRI done. However, I'll be speaking with my seniors, and they'll be in the best place to determine and request for such investigation. Is that okay with you, John?
Okay, doctor.
All right,
Thank
John.
you.
Also regarding your smoking habits as well, John, I'll be referring to the smoking cessation clinic. Is this something you are willing to do, just to
I'll
cut down
consider
your
that.
smoking?
Okay, I'll think about it, doctor.
All right, John. All right, John.
Move on
Notice.
to the next station.
Thank you for speaking with me, John.
Thank you.
Amazing, Dr. Tessie. Good job. I mean, I really like your consultation style. You know, every time you have a management plan, you're always asking for consent. You're always asking for like a shared decision making. How do you feel? What do you think about this? Right? That is awesome. That's a good way to go about this. But I want to just put it out there, you guys. So 3 weeks of hoarseness. What do you think it could be?
Laryngeal cancer.
Laryngeal carcinoma.
Thank you, both John and Dr. Aruj. We have a new participant. Absolutely. But why would you think laryngeal carcinoma? I have the findings right in front of me. It's like throat is all normal. There's no lymphadenopathy, no visible, nothing externally visible.
We should be like, we are not sure, but we should ask some history questions about weight loss and stuff like that.
No weight loss. Would you still think? Nothing
Yes.
like that.
Yes, I'll still think it's laryngeal cancer because it's mine to suspect it's a laryngeal cancer. Is the doctors,
Exactly.
the general surgeons or the respiratory doctor who want to confirm? So I'll still send to 2 weeks referral pathway.
Absolutely. Good job, Dr. John. This is a very classical case where this is a referral criteria. 3 weeks hoarseness is a referral criteria, an urgent referral criteria. It's not even like a routine appointment. It's an urgent referral for laryngeal carcinoma. The other thing is referred otalgia. If you have 4 weeks of referred pain and normal findings, this is what usually happens, you know, even though you think it's normal, you kind of, you know, this is of a high suspicion. That's why you need to do further investigations, because that is your manifestation. You know, your early manifestation of laryngeal carcinoma is hoarseness, and having 3 weeks of hoarseness without any illness, without any predisposing factor. That was one thing that Dr. Tessie understood. You know, is there anything that's causing this? There's nothing that's causing this. He's just been having hoarseness. This is an urgent referral criteria that, you know, you guys, everybody should be aware about. So I'm just going to quickly pull up the textbook that we made, and I have a couple of, you know, referral criteria is written over here, so so that you guys can take a look. Otalgia for 4 weeks without any external manifestation is also a referral criteria, right? So do keep that in mind as well. Apart from that, there was a very interesting thing that Dr. Tessie understood from, yes. So Dr. Tessie didn't think that it was, you know, that significant. And so the important thing that she did was not to let the patient go. This is very important. And because of this thing, she is actually, she has a more likelihood or a tendency to pass this case. Why? Because she referred, I mean, she involved her seniors. This is very important. If you're unsure about anything, call upon your seniors. You are going to face situations like this even in your real practice where you don't know, right? Because maybe, you know, it might be something that you are not aware of, or you might have missed. But maybe actually getting a consult, or maybe actually having a senior's opinion, can give you a better idea, right? So this is one reason I would say, Dr. Tessie, you will not fail this case. Mainly because you did not send the patient back, right? So good job there, right? Even when he asked for like further imaging, you said, yes, my seniors will take a look and they will make this decision, right? So we have some red flag symptoms over here for a couple of, you know, symptoms that you have to keep in mind, especially with the symptoms and the duration, especially when there is normal finding. Right. So if a patient actually comes with these findings, don't be quick to rule it out as normal. Right. At this point, you don't know that it's normal. So hence, ask for opinion, or seek further help. If you're unsure, these are the situations where you will be unsure. If you are unsure, make sure you seek further help. Yeah. Otherwise, the most common cause of hoarseness is acute laryngitis, which, according to the history, it doesn't seem like this patient had any kind of an upper respiratory viral infection. But the other important thing that she found out was the smoking and the alcohol history, right? So here I would like to point out to Dr. Devlin and Dr. John, see, now taking alcohol and smoking history is very relevant, because hoarseness related to these habits has a very high tendency to indicate something more sinister. While in the other case, when a patient is on heroin and other medication, you know, alcohol and smoking history is, you know, barely a blip, considering that they have a higher, you know, more, you know, there is a more risk with the other recreational drugs that they're using. And you've also understood the fact that there is mixing of these drugs. So that's even a higher risk that you have managed to uncover, right? So then, you know, actually asking these history is important, but make sure the importance when it comes to different cases, right? Because you only have so many number of questions that you can ask before your time runs out. Yeah. All right. The other thing that I wanted to quickly ask you guys is, what are the other risk factors that you understood from the history? Good job on the history. I think you covered covered good ground there. But smoking, alcohol, what is something else that could be a risk factor here? Anybody?
Yes.
This
The occupation, he was working in a garage company where he was exposed to diesel fuel, and
absolutely,
probably using the map to suck fuel. That can
absolutely.
cause,
Good job, Dr. John. That's also a positive finding that you got. So getting all these three positive finding and hostness for 3 years, 3 weeks, is definitely your 2-week referral pathway. You're going to be, going down that road. All right. So Dr. Devlin, did you have a chance to mark? Were you able to submit?
Yes, doctor, I've already submitted.
All right. Thank you so much. So let's quickly take a look. All right. All right, let's take a look. So confirm full name and age. Ask when the hostness began. That's good because you need to understand the timeline, the duration of the hostness, right? Progression, inquire if the hostness is worsening or is stable. Aggravating, relieving factors. Ask if there is anything that makes it better or worse. Perform a general physical examination, vitals, check vitals, examine the throat and lymph nodes. This is very important. Mention lymph nodes, especially when there is, when there is a concern for cancer. Definitely mention lymph nodes, right? The other thing that I noticed was when Dr. John mentioned that, I think it could be cancer. One good question that you can always ask, especially, that would count towards your interpersonal skills is, inquire a little bit more. Like, why do you think this is cancer? What makes you feel this is cancer? Explore the patient's idea. Like, he's come with hoarseness and all of a sudden he's thinking cancer. You didn't think cancer. Like, why are you thinking cancer? What is distressing you? Because that is the distress with which he came in. Right. So you can explore a little, anything that kind of sounds a little jarring, follow it up, ask a little bit more, like, why do you feel this way? Right. Like that's actually, that would actually count a lot towards your interpersonal skills as well. The other thing, associated symptoms, check for pain, sore throat or neck discomfort, red flag, ask about any neck lumps, swallowing difficulties or earaches. This is very important, guys. Definitely whenever you have a presenting symptom, try to understand what are the red flags you need to rule out. Any symptom that comes to you, think about the worst things that can happen and make sure you rule it out, right? Couple of things that were missed. Duration, clarify if the hoarseness is ongoing or intermittent. Yeah, I think I'll give you some marks for that. Within the conversation, it kind of, you kind of uncovered it. Intensity, determine how severe the voice change is. I think this is also something that you mentioned, that towards the end of the day, it kind of gets worse. Yeah. Weight loss, inquire about any noticeable weight loss. This is again an important question, especially since the patient's concern is cancer. Follow it up with some of the cancer symptoms that you know of. Like, why do you feel this way? Or have you been losing weight lately? Have you noticed that you've lost a lot of weight? Or have you lost, appetite? Have you been, have you been sweating excessively at night? These are a couple of questions that you can understand, rather than just ruling out the whole fact of cancer, and try to understand his perspective of why he's feeling this way. Yeah. Coughing blood, ask if there has been any blood when clearing his throat. Yeah. So what are the different kinds of, apart from, the laryngeal cancer, is there any other cancer that can cause hoarseness? Anybody?
Thyroid?
Yeah, thyroid cancer. Sure. Anything else? Lung cancer.
Lung cancer, recurrent laryngeal neck palsy. Yeah.
I'm so sorry. Could you please repeat that, Dr. John?
The small cell carcinoma of the lungs can cause recurrent laryngeal neck palsy and cause lung cancer, hoarseness of voice.
Mostly if the cancer is in the apical region.
Yeah, apical lung tumor, yeah.
Apical lung tumor. This causes the recurrent laryngeal nerve to get irritated, and because of which you can have hoarseness.
Esophageal
Esophageal, yeah, sure.
cancer.
So you're thinking more along the lines of hoarseness, right? So esophageal mostly goes into, dysphagia and all those kind of things, right? So there will be, dysphagia first to solids and then progressive dysphagia and then to liquids, right? So this is more like voice related, right? So you're actually thinking along the lines of anything that transmits voice and the nerves related to it. And also that's why an important question to ask is, have you had any surgeries related to thyroid? A lot of thyroid surgeries will come with, recurrent laryngeal nerve damage. So that can also come with hoarseness, right? So this guy had no any surgery. His surgical history also is also an important thing. So when you're thinking hoarseness, these are the things that you need to keep in mind. The most common cause, as we discussed, is laryngitis. Pancoast tumor, exactly. That is the apical lung tumor, which is called Pancoast tumor, right? So that also irritates the recurrent laryngeal nerve. See, that is also cancer, right? So another question you can ask is about the cough and any blood in sputum, right? So that's also something that you're thinking around, right? But this person had nothing. So it is more indicative towards the laryngeal carcinoma. And this is definitely a 2-week referral. This is something that you can't diagnose by just asking questions or just doing a physical examination. You need to do further examinations, hence the 2-week referral. That's what you will be explaining in your management. So you've identified that this is a high-risk case. You don't know that this is laryngeal cancer. There is a high likelihood of it being laryngeal cancer. Yeah. And so what your next step is to refer, right? That comes in your management. So what I'm saying, in your exam, you are in FY2. And as an FY2, you are needed to recognize signs and understand where to send the patients. And if you feel that you're unable to do that, seek senior help. They expect you to do that because you're not an individual doctor, you work as a team, right? All right, so let's take a look at the management. So management, so in this case, because we have made it in a way where, only if you get it right, you get points in management, but there is always a loophole to that, which is if you don't know the management, refer them or at least seek senior help. If you have done that, you are being a safe doctor. The first thing in this examination that they assess is whether you are a safe doctor. And by seeking senior help, Dr. Tessie has been a safe doctor. And I think I would pass you for management in this case, especially when it came to doing the test also. You mentioned that I think after they take a better look at you, we could, settle on the decision of whether or not you need further imaging, right? And mostly further imaging would be a laryngoscope, where you will actually put a scope down the throat and you will be looking for any, masses, right? So that's usually what is done. All right, otherwise, the management that is ideally what we are looking for is discuss the risk factors related to smoking and diesel fume exposure. So that is also something that you uncovered from the history, that this patient has risk factors of smoking, drinking, and occupational. So mention that, because when you're managing the patient, you want them to, have a lifestyle that does not worsen their condition. So by making them aware of what can worsen their condition is a part of your management as well. Yeah. Discuss potential treatment options if the condition is confirmed. Yeah. Missed, express concern about the symptoms described, explain the significance of hoarseness lasting over 2 weeks. It's actually 3 weeks. Clearly state the suspicion of laryngeal condition handle patient reaction with empathy and reassurance. So usually when you tell somebody that, there could be a chance that it could be cancer, usually people get a little, perturbed. So that is something that you need to handle with a lot of care, right? And reassurance. Plan for an urgent referral to ENT referral under the 2-week wait pathway. Explain the likely investigations such as nasoendoscopy and biopsy. Provide safety netting advice for worsening symptoms. Offer follow-up and provide leaflets on voice changes and ENT referral. Yeah, so definitely, even if you can't do anything towards the end of your station, try to do these 3 things. It will give you some marks. One is follow-up, safety netting, and leaflets. Somehow try to incorporate that in your management. Somehow, as soon as you hear the 2-minute bell ring, somehow try to slip it in. Make sure to do that. You will somehow get some marks for management. So that is very important. And it's easy to get. Right, so your presenting symptom is hoarseness. So you can see that I'll give you some leaflets about hoarseness and what to avoid when you're having this condition. So you can just say things like that, right? You can give leaflets about anything. So try to be a little more creative about what leaflets you can provide your patients. Yeah. Awesome. Interpersonal skills: acknowledge and validate the patient's emotions, use sensitive and empathetic language throughout the consultation, reassure the patient and offer support throughout the consultation. Partially covered: request permission to gather information before addressing concerns. Signpost the urgency and next step clearly to the patient. So there was one thing that I noticed, that when you asked about the smoking and the alcohol history, you were a little direct, like, do you smoke or do you drink? And it's kind of a little personal to ask such questions. Even when it comes to sexual history, it's a little personal to ask such questions. So try to signpost these kind of questions, where you should go along the lines of, I have to ask you a couple of questions that is important for my consultation. And this is something, that would help me understand your condition better. And then go ahead and ask your questions, so that they are aware. Excuse me. All right, guys, that was the last case for today. Thank you so much, Dr. Tessie. Thank you, Dr. John for simulator, and Dr. Devlin for marking. Thank you, guys, for participating in today's mock. And we hope to see you guys again next week. And until then, we will be posting a couple of blogs about the cases that we have done so far. And if you have any questions, any doubts, please don't hesitate to ask. And as a special thank you for everybody who's joined, we are offering a 20% discount on the OSCE workbench and the app that we have created. So if you are interested, I will be asking the moderator to put a link for the coupon code, so that if you're interested, you guys can go ahead and avail the 20% on all plans. Thank you, everybody, and have a good evening.